Which condition is screened using the triple test during pregnancy? Hypertension, placenta previa, gestational diabetes, Down syndrome. Correct answer is option D, Down syndrome. Which is the most favorable fetal presentation for normal vaginal delivery? Breech, transverse lie, vertex, face. Correct answer is option C, vertex. What is the recommended position for a laboring woman to reduce pressure on the vena cava? Supine, latotomy, left lateral, upright. Correct answer is option C, left lateral. Which type of twins share the same placenta? Dizygotic twins, monozygotic, fraternal, none of these. Correct answer is option B, monozygotic twins. What is the term for a woman who has given birth more than once? Primigravida, multigravida, primifera, multifera. Correct answer is option D, multifera. Which part of the pelvis is assessed during a pelvic examination to determine adequacy for childbirth? True pelvis, false pelvis, pelvic brim, iliac crest. Correct answer is option A, true pelvis. Which fetal presentation poses the highest risk for umbilical cord prolapse? Breech presentation, cephalic presentation, transverse lie, occiput anterior. Correct answer is option C, transverse lie. What is the typical shape of gynecoid pelvis? Round, oval, hard, flat. Correct answer is option A, round shaped. Which immunization is routinely given to all newborns at birth? BCG, hepatitis B, DPT, polio. Correct answer is option B, hepatitis B. What does the term gravida means? Number of deliveries, number of live births, number of pregnancies, number of abortions. Correct answer is option C, number of pregnancies. The best time to hear fetal heart sound using a fetoscope is 8 weeks, 12 weeks, 16 weeks, 20 weeks. Correct answer is option D, 20 weeks. The ideal time to give anti-D immunoglobulin to an Rh negative mother is immediately after delivery, at 20 weeks of gestation, at the onset of labor, only during cesarean section. Correct answer is option A, immediately after delivery. Which stage of labor involves the delivery of the placenta? First stage, second stage, third stage, fourth stage. Correct answer is option C, third stage. Which infection is most likely to be transmitted from mother to baby during vaginal delivery? Hepatitis B, HIV, syphilis, herpes simplex virus. Correct answer is option D, herpes simplex virus. What is the ideal birth interval between two pregnancies? 6 months, 1 year, 18 to 24 months, 36 months. Correct answer is option C, 18 to 24 months. What is the primary purpose of administering magnesium sulfate in eclampsia? Prevent seizures, stimulate labor, control blood pressure, increase urine output. Correct answer is option A, prevent seizures. When does implantation of the fertilized ovum typically occur? 1 to 2 days, 7 to 10 days, 14 days, 21 days. Correct answer is option B, 7 to 10 days after fertilization. Which of the following vaccines is contraindicated during pregnancy? Tetanus, hepatitis B, rubella, influenza. Correct answer is option C, rubella. What is the purpose of a farthograph? To monitor fetal growth, to record maternal nutrition, to calculate gestational age, to assess labor progress. Correct answer is option D, to assess labor progress. The best method for assessing fetal growth is fundal height, maternal weight gain, fetal movement, abdominal girth. Correct answer is option A, fundal height. The hormone primarily responsible for maintaining pregnancy is estrogen, progesterone, oxytocin, relaxin. Correct answer is option B, progesterone. What is the most common site of fertilization in the female reproductive tract? Cervix, uterine cavity, ampulla of fallopian tube, isthmus of fallopian tube. Correct answer is option C, ampulla of fallopian tube. The hormone responsible for milk ejection is estrogen, progesterone, prolactin, oxytocin. Correct answer is option D, oxytocin. Which vitamin is essential to prevent neural tube defects during pregnancy? Vitamin C, folic acid, vitamin D, vitamin B12. Correct answer is option B, folic acid. Which midwifery tool is used to listen to the fetal heartbeat manually? Doppler, fetoscope, stethoscope, cardiotocograph. Correct answer is option B, fetoscope. Which of the following is a common indication for a caesarean section? Breech presentation, premature rupture of membranes, anemia, placenta previa. Correct answer is option D, placenta previa. What is the term for the first milk produced by the mother after delivery? Colostrum, transitional milk, mature milk, hand milk. Correct answer is option A, colostrum. The best way to assess fetal well-being during labor is abdominal girth, fundal height, fetal heart rate monitoring, pulsating fetal farts. Correct answer is option C, fetal heart rate monitoring. Which position is preferred for a breech delivery if a vaginal birth is attempted? Praying breech, complete breech, footling breech, transverse breech. Correct answer is option A, praying breech. In water births, what is the primary benefit for the mother? Reduced risk of tearing, improved oxygen levels, pain relief through buoyancy, faster labor progression. Correct answer is option C, pain relief through buoyancy. Which condition involves high blood pressure and proteinuria during pregnancy? Eclampsia, pre-eclampsia, gestational diabetes, placental abruption. Correct answer is option B, pre-eclampsia. What is the common term for the spontaneous loss of a pregnancy before 20 weeks, preterm labor, stillbirth, miscarriage, ectopic pregnancy? Correct answer is option C, miscarriage. Which part of the fetus is most commonly felt first during abdominal palpation in cephalic presentation? Back, head, limbs, buttocks. Correct answer is option B, head. What is the term for the softening of the cervix during pregnancy? Gorell's sign, Hagar's sign, Chadwick's sign, quickening. Correct answer is option A, Goodell's sign. What does the term station refer during labor? Fetal heart rate, position of the baby, descent of the presenting part, cervical dilation. Correct answer is option C, descent of the presenting part. What is the name of the fetal membrane closest to the fetus? Chorion, amnion, placenta, umbilical cord. Correct answer is option B, amnion. Which sign indicates true labor? Braxton Hicks contractions, irregular contractions, cervical dilation, back pain only. Correct answer is option C, cervical dilation. Which vitamin helps prevent neural tube defects in the fetus? Vitamin D, vitamin B12, folic acid, iron. Correct answer is option C, folic acid. What is the term for the bluish discoloration of the cervix during pregnancy? Chadwick's sign, Goodell's sign, Hagar's sign, none of these. Correct answer is option A, Chadwick's sign. What is the recommended position for breastfeeding? Supine position, cradle hold, latotomy position, Fowler's position. Correct answer is option B, cradle hold. What is the most common cause of postpartum hemorrhage? Uterine atony, retained placenta, cervical tear, placental abruption. Correct answer is option A, uterine atony. What is the purpose of administering Rh immunoglobulin to an Rh negative mother? To prevent fetal anemia, to prevent Rh sensitization, to prevent miscarriage, to increase fetal growth. Correct answer is option B, to prevent Rh sensitization. What is the term for the first fetal movement felt by the mother? Lightning, effacement, quickening, engagement. Correct answer is option C, quickening. What is the primary function of the placenta? Hormone production, nutrient and oxygen exchange, waste removal, all of the above. Correct answer is option D, all of the above. What is a common sign of ectopic pregnancy? Vaginal bleeding, abdominal pain, shoulder pain, all of the above. Correct answer is option D, all of the above. What is the ideal site for IM vitamin K injection in a newborn? Vastus laterale, deltoid, gluteus maximus, rectus femoris. Correct answer is option A, vastus laterale. What does Leopold's maneuver assess? Fetal position and presentation, amniotic fluid levels, uterine contractions, cervical effacement. Correct answer is option A, fetal position and presentation. Which method is commonly used to estimate the gestational age of a fetus? Leopold's maneuver, fundal height measurement, F-gar score, none of the above. Correct answer is option B, fundal height measurement. What is the most common presentation during normal labor? Breech presentation, cephalic presentation, shoulder presentation, transverse presentation. Correct answer is option B, cephalic presentation. What is the primary risk associated with preterm premature rupture of membranes? Shoulder dystocia, infection, postpartum hemorrhage, cord prolapse. Correct answer is option B, infection. What is the term for excessive vomiting during pregnancy? Hyperemesis gravidarum, morning sickness, dyspepsia, eclampsia. Correct answer is option A, hyperemesis gravidarum. A mother with gestational diabetes is at risk for delivering a baby with low birth weight, hyperthermia, macrosomia, microcephaly. Correct answer is option C, macrosomia. Which hormone causes relaxation of pelvic joints during pregnancy? Progesterone, estrogen, oxytocin, relaxin. Correct answer is option D, relaxin. The main goal of active management of the third stage of labor is to prevent postpartum hemorrhage, neonatal hypoxia, uterine rupture, none of the above. Correct answer is option A, postpartum hemorrhage. What is the main function of oxytocin during labor? Increase maternal blood pressure, relax uterine muscles, stimulate uterine contractions, suppress fetal movements. Correct answer is option C, stimulate uterine contractions. In Afremi gravida, engagement of the fetal head usually occurs before labor, during labor, after rupture of membranes, after full dilation. Correct answer is option A, before labor. The best position to place a pregnant woman experiencing supine hypotension is left lateral, right lateral, supine with legs elevated, high Fowler's. Correct answer is option A, left lateral. The first breast milk produced after birth is known as fore milk, transitional milk, mature milk, colostrum. Correct answer is option D, colostrum. What is the purpose of administering vitamin K to newborns? Prevent bleeding, promote appetite, prevent jaundice, boost immunity. Correct answer is option A, prevent bleeding. The term lightning refers to rupture of membranes, engagement of fetal head, onset of labor, expulsion of mucus plug. Correct answer is option B, engagement of fetal head. Which of the following is a contraindication for vaginal delivery? Previous cesarean section, breech presentation, placenta previa, gestational diabetes. Correct answer is option C, placenta previa. Which is a danger sign during pregnancy? Blurred vision, leg cramps, mild ankle edema, constipation. Correct answer is option A, blurred vision. What is the common cause of anemia during pregnancy? Folic acid deficiency, iron deficiency, vitamin B12 deficiency, vitamin C deficiency. Correct answer is option B, iron deficiency. Which fetal condition is best monitored using a biophysical profile? Fetal heart defect, fetal anemia, fetal well-being, none of these. Correct answer is option C, fetal well-being. The first stage of labor ends with full cervical dilation, delivery of baby, crowning, rupture of membranes. Correct answer is option A, full cervical dilation. The most common complication of eclampsia is pulmonary edema, cerebral hemorrhage, renal failure, none of these. Correct answer is option B, cerebral hemorrhage. A baby born at 32 weeks is classified as full term, first term, preterm, small for gestational age. Correct answer is option C, preterm. The main reason for delayed lactation is prematurity, cesarean section, stress and anxiety, formula feeding. Correct answer is option C, stress and anxiety. A nurse sees a baby with asymmetric Moro reflex. The suspected cause is neonatal sepsis, hypoglycemia, brachial plexus injury, none of the above. Correct answer is option C, brachial plexus injury. A pregnant woman with a painless dilated cervix in the second trimester likely has incompetent cervix, threatened abortion, ectopic pregnancy, preterm labor. Correct answer is option A, incompetent cervix. Thanks for watching. Subscribe to the channel for the latest informative MCQs.